Legislative session, Governor Joe Lombardo is commemorating the new bills signed into law with a ceremonial signing.
Many of those bills set to impact the healthcare industry in our state. And our Jane Davenport, you attended the ceremony just hours ago, and you join us now here in the studio with a breakdown of each bill and how they're going to impact all of us living in this state.
Yeah, Dana Marie, the long-awaited Nevada Health Authority was established in this year's legislative session, also known as Senate Bill 494. The goal of this authority is to leverage the state's buying power while also lowering the cost of health care. And several other bills signed today also aim to benefit people in the state when it comes to affordable and efficient health care.
Everything relies on our healthcare workforce work right now, so making sure we can get people to come into our state, let them know that healthcare is open here and that providers can live and work and have a great life.
Stacie Weeks with the Nevada Health Authority also notes that with changes to Medicaid nationwide, Nevada isn't seeing any cuts to the state budget at this time.
And I think it's an important thing to build off what you said, not at this time, as far as cuts to Medicare or Medicaid. Because the bill doesn't direct any cuts. The big, beautiful bill doesn't direct any cuts in the short term.
So I think for Nevada, we may be in a different place than other states.
Representatives of another bill signed into law by the governor hope to expand its impacts to other states. Assembly Bill 463 reforms the state's current prior authorization laws.
It makes a huge difference for our patients. And we spend most of our life trying to get authorizations for things done, and this will really help.
Now, instead of waiting 20 days, the law requires the insurer to respond to the request for prior authorization within 2 business days.
If you have a cancer patient in front of you, delaying that care and delaying that test could really impact them both from a mortality, dying process, as well as a morbidity.
So instead of waiting for life-saving treatment or wasting time in hospital lobbies, these doctors hope this new law will expedite the care their patients need. And as the state works to improve health care, Senate Bill 262 is working to bring and keep more doctors in the state by transferring the graduate medical education programs to the new Nevada Health Authority.
With the amazing news of opening more medical schools from UNLV to Roseman, of course we have UNR and Touro, it became really important to me to keep these doctors here in the state. This is, an incredibly proud moment to know that we can keep more doctors practicing here in the state and we can have more accessible health care.
And along with those health care bills, the ceremonial signing featured legislation ranging from resident protection, renaming famous roadways, and establishing databases to track victims of mass casualties. Dana Marie.
An impactful day for advocates of those laws. Thank you, Jane.
Okay, so we know the president signed hundreds of bills into law, more than 500. That includes legislation aimed at stricter penalties for animal abuse offenders and those who drive under the influence. But he also vetoed 87 bills, the most in the history of our state.